remember Rich saying as we were going up, and this flashed through my head, he was like, the worst thing anybody could do would be to jump off a horse if it like just goes. And I was like, oh, really? And he's like, yeah, like that's when you get really messed up. Like, and I was like, oh.
I found out that she wasn't telling the truth. The next morning I fired her. And she was really, really angry. That was 22 years ago. And I didn't think that I could do that. So all those doctors out there, I'm going to tell you that sometimes you have to make some bold moves. And it was a bold move. So you worked as a hygienist for how long?
I think like 16 years, somewhere right around there.
And then what happened?
Yeah. So my hands are shot. I've got carpal tunnel. I had surgery back when, I don't remember when, probably it was like 2 probably, something like that. And it's back, so my hands are done.
Welcome back to Riding Shotgun with Dr. Lon McRae. We have Deborah Young and Katie Pierce, and we're grateful you're here. Are you guys nervous?
Totally.
Just a little bit.
Well, we're going to be talking about a lot of different things. First topic is what do you think about transgenders in sports?
Oh, stop. Give it to Lon. It's not fair.
They could have their own.
I'm totally kidding.
section.
I'm totally kidding. I'm totally kidding. You two are one of the first ones on this podcast. How long have you worked at McRae Dental? We'll start with Katie.
I was thinking about it on the way over, in fact. 22 years.
Wow.
22 years.
Did you know that?
I knew it was getting close to 20. I didn't know that it was 22 years.
Mm-hmm.
I'm sorry and thank you.
Of course.
Deborah?
I know when it was. I'll have to count backwards. I think it's 18 years. 2007.
Does that include your internship or when you first?
No, it doesn't.
So almost 19, almost 20 years.
Yeah, because I helped watch the kiddos and slowly clean the office and work my way in, recare, and get my foot in the door.
I don't want to get emotional, but thank you.
Oh, thank you.
Cut.
No, seriously, I'm 20 years together. I appreciate you guys.
Thanks for keeping us around.
Yeah, seriously.
Why? Why are you still around? What do you guys do? First of all, what do you do at McRae Dental? So, Katie, tell us your story. You started
Started in dentistry as an assistant.
where?
In Houston, Texas, and went to hygiene school down there. I had a cousin that was a dentist there, so I worked for him for a while, kind of got my feet wet in dentistry, make sure I wanted to go in, and yeah, went to school down there, worked for about a year, and then moved back to Idaho. Obviously, I'm from here, and
Did you like being a
Wanted to be home.
hygienist?
yeah, totally. Loved it.
You were a hygienist for how long?
Ooh. 16 years, probably.
And
somewhere
how
in
many
there.
offices did you work at as a hygienist?
2 like full-time permanent positions. You're one, and then a guy named Dr. Gray in Houston.
In Houston.
Yeah, I subbed a little here and there.
So let's tell the story of how you became.
Oh boy.
Oh boy, this is quite the story. So what happened? Your mother.
Yes.
We knew your mother, and my wife
Mhm.
knew your mother, and because she was teaching one of my sons,
Mhm.
and she came to me and said, "You need to do a working interview with Sue,
Mhm.
Sue's daughter," and I said, "I don't need a hygienist." That was that, and I literally said, "No, I'm not doing the interview," and that's when my wife said, "You will do an interview." Because she needs just experience doing these working interviews. You knew that, right? That
I knew it was a favor for
yeah,
sure.
Yes.
Yeah.
So you came in, and at the time, what we did is we would have a lunch meeting, and during these lunch meetings, well, I don't know whether I should go into this or not, but I'm going to. During these lunch meetings, what I would say is, okay, you would come in, do your working interview, you would go to lunch with 2 other employees,
Oh, that's right.
and not me. And you would be able to ask questions. They could ask questions of you.
Mhm.
And so I think I said to one of the assistants in the front desk, take Katie to lunch. The head hygienist at the time was offended that we were even having another hygienist come in, and she
I see.
said she was questioning, why are you doing this? And she was very upset. And I said, if we're just doing it as a favor, and potentially let's keep her resume if she's good.
Yeah.
You came in, you did your working unit. Do you remember that day?
Yeah.
22 years ago?
Yeah, I do actually. We went to a Mexican restaurant for lunch.
Oh, so you do remember that. Okay. I just remember you going to lunch. I didn't think much of it. Afterwards, I went to some of the team members and I said, hey, did the lunch go with Katie? Because I was really impressed with you, and I thought, boy, she's really good. And so they said, and I had said okay to the two that were going to go. Oh, let me back up. And this hygienist questioned me when I said to the two people I asked to take the lunch, shouldn't I go to the luncheon? And I go, no, these two are fine. She goes, I really think I should go. And I said, no, these two go. Anyways, what ended up happening, you went to the lunch. They came back. I found out from one of them that I can't say it. The other hygienist took you to lunch and forced her way in. Correct?
I remember it was two
Did you know that though?
I didn't know she pushed her way in, but no, I remember who took me.
And so what ended up happening is I found that out, and I was really upset. And so I then before she left, I talked to the head hygienist, and I said, hey, why did you go to lunch? And she goes, that Katie said that she would be more comfortable going to lunch with the hygienist and not an assistant. So I called you that night, asked you how it went. You thanked me for the opportunity, right? And then I asked you, what did I say?
I don't remember.
I do.
I came to your house.
Oh, yeah, that's right. You came to my house.
Mm-hmm.
And then I asked.
I don't know if it was that night.
I said, because you thanked us. You wanted to come to the house.
I brought you cookies at the office as a thank you.
And then you came to our house. We were in a rental building our new home.
Yeah.
And you came, and I remember asking you, how was the lunch? And did you tell Amy, the head hygienist, that you wanted to go with a hygienist because you would feel more comfortable? And I remember your response. Remember what you said?
Maybe that I wouldn't care. I was an assistant before.
That's exactly what you said. You go, I was an assistant. I don't care who I went to lunch with.
Yeah. No snobbiness here.
And so the next morning I found out that she wasn't telling the truth. The next morning I fired her. And she was really, really angry. That was 22 years ago. And I didn't think that I could do that. So all those doctors out there, I'm going to tell you that sometimes you have to make some bold moves. And it was a bold move for our practice, and it set a new precedent that the one thing that we just can't deal with is lying within the office. And so it was really good for us. And I think actually for this head hygienist, she found love in another field in a different area. But that was 22 years ago. We have seen, we've seen a lot that you've been through. Mm-hmm. You got married. You had 14 kids. You
guys have seen me through a lot. Yes.
How many children you have?
Two.
And what are their names?
Carter and Brooklyn.
And what just happened to Brooklyn?
She's graduated high school.
Oh my goodness! Your little girl's growing up.
I know.
How is that as a mom?
I'm super excited for her, of course, but I'm totally sad for us.
But she's going to spend a year.
Yeah, she'll be at home for a little bit. Mm-hmm. She'll be at home, go to school.
And when she finally leaves, is that going to be hard?
Yeah, of course it is. Are you kidding me? She's like my best friend.
Will it be harder for? I'm going to ask. Yeah. Is it harder for you as a mom thinking that your daughter leaving or a son leaving?
Daughter. Probably by the time Carter gets there, I'll be like, go.
What about Rob?
Is he sad about it?
So is he? Is it?
Yeah, he was like emotional at her graduation. Aww. He was crying. Yeah.
Oh, that's pretty cool.
She's our girl.
Yeah. So you worked as a hygienist for how long?
I think like 16 years, somewhere right around there.
And then what happened?
Yeah. So my hands are shot. I've got carpal tunnel. I had surgery back when, I don't remember when Brooklyn was like 2 probably, something like that. And it's back, so my hands are done. So luckily, Dr. McRae offered me a job at a desk. Thank God, made me a physician.
And we can't imagine not having you in the office.
Thank you.
You
100%.
do a little of everything, don't you?
Definitely.
What did you do for me today?
Dropped your car off at the body shop and yeah. Mm-hmm.
Yeah. So
Arrange,
my truck got damaged, and so you do everything.
Just to fill in wherever.
Well, it's more than
You
just
do
a
a
film.
lot.
Yeah. So your main thing that you do with the office is what?
I don't know what my title is. Like a surgery coordinator, maybe.
Yeah.
A little bit of everything.
But you coordinate all the surgeries. You make sure all of the implant parts and everything else, and make sure that the patients are taken care of from start to finish.
Yeah,
right?
Totally.
What is the biggest frustration about what you do right now?
Just a lot of multitasking, a lot of little fires to put out or little things to deal with along the way. So just a lot of distractions and, go back to this. It's like squirrels and yeah.
It's the front desk life.
Yeah. Just a lot of multitasking. Whereas before it's all sit down, take some x-rays, clean your teeth, get an exam. Bye.
Does it feel hard sometimes to direct the doctor of what he needs to do?
No. I don't have a problem with that.
Because you all direct me of what I need to do.
It.
Right?
You need it.
Yes.
Yeah.
That is very true. Okay. Deborah.
Yes.
So you started out as an intern.
Yeah, I did. Before I got my first job, too. That's right. I did intern.
Mm-hmm. You started with us. Oh, that was a long time ago, too.
Yeah, that's right. My hubby did end up coming home.
And you guys dated for 3 days and got married.
Pretty much. It was 3 dates and we were engaged.
Oh, it really was only 3 days?
It really was.
Dang,
but we talked for a few months before. He was working in Sun Valley. So we got to know each other on a deeper level. But yeah, we hung out 3 times and that was it.
And then you were married.
And then our first date was actually Hawaii with his family. It was kind of crazy. I had to eat humble pie. I was definitely the person that was date for a year. You need to know every side of them. Because my parents were divorced, so I was nervous. And gave my roommates a hard time. 4 months? How can you get engaged after 4 months? I'm three times hanging out. Yep. Sometimes you know. 18 years. 18? 18, oh my gosh, no, 19. Right. 19 years in April, this last April. So we're on our...
So you're going towards 20 next year.
Yeah.
And you have 3 kids.
Yep, 3 kids.
Okay. And how old are they?
I have a 13, almost 14-year-old, my oldest Eden, and then she's a girl, and then I have Mason, our little guy. He's in the middle, he's 10. And then Noelle, our little caboose, turned 5 in December. Yeah.
And you have the funnest job in the entire office.
I do.
Because you do the thing that everybody does not want to talk about.
Or fix everything for everybody.
Which is what's your position?
Well, I help run the office manager. And do putting out fires. Katie helps me put out fires too. She's my good wingman there. But yeah, it's amazing how many things come up in an office. People probably think I don't do something, but it is constant. People coming up, I need this. How do I do this? This is a problem. And all the floods in our office. Oh my gosh. It's always something, but I like it. I never feel stagnant too, though. I like that. It pushes me. You've always pushed me. It's not I started out assisting for 4 or 5 years before I came to you until you had an opening, right? Slipped in, cleaning his toilets at the office for you.
Oh, you did do that?
I did, yeah. With Janae.
Yes, I remember.
Uh-huh. And then did recare. And then we went on that Silver City horse trip.
Oh yeah.
Oh,
yeah.
We'll never forget that.
Yeah. Yeah.
So tell them about that. What did we do? So we try to do different things in the office.
Yeah.
Things to unite us. They don't always unite us. But
Usually.
what was that one? What did we do? It was like October, November.
It's cold.
It was
Oh yeah,
fairly
it was
cold.
Yeah.
And we got a bunch of horses.
Yeah. You
And
borrowed racing horses.
I borrowed
from someone.
2 racing horses.
Yes.
Oh, this is the funniest thing.
That sounds like a
Okay.
liability.
No.
I know.
So
And I was the only one that had health insurance in the group.
we
I
had
remember that.
I brought like 6 horses, and then Rich France, good friend of ours, went and he was dating Janae at the time.
Yeah.
Remember?
Oh yeah.
And then he went and got some racing horses. That's true.
Mm-hmm.
But they were good horses.
They're good horses.
And so we went up to this cowboy town, and we rode into literally a saloon. We put our horses into this corral. We went into a saloon. They showed us around the town. You remember
a hotel.
that? The hotel.
Oh, the old Masonic building.
Yes.
Right? Yeah.
Yep. And then we had dinner at the saloon, literally this old saloon. And I remember do you remember the picture that was in the saloon?
Walls were peeling. Like, I was
It
like.
was old.
I have pictures of you there
You do?
behind the bar.
Do you remember the photo that was in there?
No.
Okay, it's
Creepy.
I'm pretty sure it was Theodore Roosevelt was there.
Oh.
It was like Billy the Kid, and like there was
Wow.
like really famous people. Like I remember it was maybe Thomas Edison. It was like all together at the same time in this
Wow.
one picture, and it was all in Silver City, Utah, or Idaho. Silver City, Idaho. And I was just like, my goodness, this happened here. It has a very rich history, but now it's just this tiny stamp of a place, but it's beautiful. There's in the pine trees, and it's really pretty. I do remember it was cold that day.
Yeah.
But do you remember going back?
I do remember going back.
And so we were going back down the road, and I was with Holly a little bit further, and then all of a sudden I hear this screaming. And it's this, then someone...
Okay, wait a minute.
Yeah.
You have to preface that I had this beautiful roan horse that was huge, and I was doing a good job with it because
It
I'd
was a
ridden
white
horse. I know that was your horse. That was
No.
the naughty horse.
No.
Had you
no.
ridden
And
horses before?
Yes, I traded with my grandparents. I traded horses with Casey because she was having troubles with it.
That's what it
And
was.
you took it, and you're like, I'm going to teach this one a lesson. And so you gave me yours. And I remember sitting in the saddle, and I'm 5'8", but I am all torso. So I was like, can these stirrups be any shorter? And you're like, no, this is the shortest because it was your custom saddle because it was your Ghost. Is that right, the name of it? Or was it a white one?
Was I riding Ghost? to begin
Yeah, you
with?
were. Yeah.
Oh,
Ghost
okay.
did not like me. Or the racing horse next to us. So you were up ahead and helping Katie, and I was with Janae and Rich, and they were riding race horses. And your horse got some sort of competitive edge with the race horses because we were side by side. And I remember Rich saying as we were going up, and this flashed through my head, he was like, the worst thing anybody could do would be to jump off a horse if it like just goes. And I was like, oh, really? And he's like, yeah, like that's when you get really messed up. Like, and I was like, oh, crazy. Like, like going up Silver City, then we're coming down. And then the horses, Janae's horse and my horse, like started trying to like challenge each other. And so we kept having to like rein them in and stuff. And then her horse just started going and racing. So then Ghost just took off. And then my legs didn't fit in the stirrups. And I was hitting him like on the sides with my legs bouncing.
Well, your legs were hitting it in the stirrups. I just remember opening the gate
Yes.
and looking back and hearing you scream. And as you're screaming, the stirrups are hitting the horse in the side,
Yes.
going, go faster.
I know.
And I'm like, oh no. And then I see Deborah doing this. And you start, and you're literally
I literally
on
was
your
like,
side.
where should I go?
And
should
I'm
I
yelling.
jump off here? Should I jump off there? No,
And
don't jump off.
I saw the look in your face. I'm yelling, do not jump. Stay on the horse. Don't jump. And I ran and got in the way, and it stopped literally
The
right
cattle
in front
guard.
of
I was about to say,
You
wasn't
jumped
there
in front of the
cattle guard?
cattle guard
Yeah.
because you're like, that horse would have broken its leg and
anyways, yeah.
and it reared up. And I stayed on the whole
you know what?
time.
You did.
Oh.
And I held those reins.
Way to go. You really did.
I did. It like reared up and everything at you, and you're like, whoa. And then, and then you're like, really quick, you're like, okay, I'm going to take this one. Let's go. And then you were helping Katie. And then you're like, okay, you take this horse. Then I took it. I was like, okay, I'll get on a horse again. Like, it was like, and then I just got right back on a different horse and we went. But that was the scariest thing.
That?
Oh, yeah. Oh, yeah. I remember.
Yeah, it was super scary.
But it was fun.
It was fun. It's a good story. It's a good memory.
I'm glad you didn't fall off.
Yeah, I'm too. I'm glad. I literally like the banks and stuff because we were on like a trail that had like some steep sides on it too. And I remember like Rich said, don't jump off, but I could totally jump off right there as I'm trying to like hold with my thighs and my arms. I'm like, I could just do that. It's really close. It's really close.
It was narrow.
It was.
I remember that night.
But I'm glad I hung on. I'm so glad you were there. That was the scariest thing ever, for sure.
You know, what's the similarities of that whole story and you're working at the office? Because there's a lot of similarities. Because you just
holding on. Rein it in.
So Deborah, you started as our financial coordinator.
Yeah.
How is it dealing with patients and finances? I mean, is it something that you enjoy?
It is. It is something I enjoy. It's something really personal. I think like I find it personal because like I'm not made of money. I don't just have the cash to throw down. So I feel their empathy for them too if something happens that they're not planning. And I think that helps me associate with them. And I'll even throw out, I've done the 0% for a couch. Like I totally get it. And then paid that off with credit card to play the credit card game. So I totally get where they're coming from all sides, I feel like. And I just think it's really personal because you have to share those like things that maybe you don't even share with your friends about like to apply for credit or things like that. So I do value the trust that they share when they come and they want to. And I do love crunching numbers. I do. I don't know if I should have been an accountant in a past life, but I just love it. I used to work in retail and I love when they line up and.
So thinking about along those lines, what is different about our office in comparison to most dental offices? What would you say would be when it comes to the financial side of it? Why is our office a little bit different?
I feel like we're not trying to sell people. I think we're genuinely trying to help them.
But what's the difference in the type of treatments that we do in comparison to most dental offices?
Well, most dental offices, I think, are patching.
Bigger treatment plans.
Yeah.
So fixing the issue.
How big of a treatment plan do we do?
We can do anything small, from sealants, cleanings, the basic stuff, on to all your cosmetic work.
$60,000 cases.
Big stuff, all on fours, implants.
So I think that's what we kind of pride ourselves in, is the ability to be able to do everything kind of all at once.
Yeah.
So we sedate you, and we'll do a full mouth rehab that could be as much as $60,000 or $70,000, which is a lot of money.
It is.
And what's the hardest part about when we are treatment planning someone? Who do you have to rein in the most?
McRae. McRae has a heart of gold and wants to do everything for free. You could, you would help everyone and do everything. You really do. And I value that and I love that about you.
But you also hate it.
But yeah, I don't, because like I do think that some people can abuse and use that for you. So I feel like I have to protect you and help the business too.
So they've sworn me off, literally, of being able to talk to patients about financial.
That's a no-no.
So I can't talk anything about it. And that's
still
actually,
does.
and I still do. I know. But that's one of the things that I wish we could do more for patients when it comes to that.
Oh, of course. Yeah, of course.
And do a lot.
But then again, I mean, we do quite a bit for patients financially.
Oh yeah.
And especially with the financial side of things, and like, what are some of the options that we give patients? Like, let's say that they wanted. Yeah, let's say somebody came in, they needed $10,000 to do some veneers. What are the options that I mean, who has $10,000? So
some people do.
Yeah, some people do.
A lot of people don't right now.
Yeah.
Yeah. Like it's kind of a mix right now.
Are you seeing that it potentially is getting a little worse?
I just think that people definitely like want detailed information a little bit more to know where their money's going, like what exactly you're doing or things like that. They want to like not nickel and dime, but like
Understand.
yeah, understand what they're putting it into.
I heard somebody talk about eggs. It was a baker, and they were just talking about what a carton or a case of eggs. I don't know how many it's a case of eggs for a baker. And it was only 2 or 3 years ago. Cost $15 for this case of eggs. Now it's anywhere between $50 and $100 for that same case of eggs.
Wow.
That's so ridiculous.
Now I think now take that all across the board, and people say, well, we're not in. If you look at the definition of a recession, we're actually not in a recession. But boy, it sure feels like that.
Yeah. Yeah.
And I mean, you look at, I mean, the cost of food, the cost of, I mean, when was a McDonald's meal $15?
Oh yeah.
It's just
Or $40 to take like it's crazy.
Costa Vida, take your family, and it's $60.
I know, and that
For a
used to be like a
server.
nice sit down restaurant to
Yeah.
me, like not fast food or drive through.
It really is kind of. I mean, so I think of those things, and then I think, okay, I just presented 10,000, 12,000 for this patient, and because our costs go up, you guys see it on the other end. You see what things cost for the dental practice.
Yeah.
And people all the time come in and say, okay, where's his Corvette outside? Where's his
I hate
Ferrari?
that.
Where's this? Right?
Where's this Kia?
Yeah. How many years did I drive a Kia?
You had a
And
beater
your
a
old
lot.
vehicles.
When I met you, you drove a Ford Focus.
Yeah.
I remember.
Do you remember
And
when,
a green truck, like an old green
do
Chevy.
you remember when I bought Casey's car?
Yeah,
And I
the
drove
Honda.
it for a long
Oh,
time.
you did the Civic.
The
Huh?
Civic.
Yeah, I did
Wow, I
Civic.
drove that for a long time.
It's not going to your cars.
No, it's definitely not. But you've seen a lot through the practice. What would you say to somebody that said, man, it's so expensive? Dentistry is, in fact, did you know that there is legislation to try and make dentistry government controlled, where it would all be the exact same. Basically, it would be you get this certain insurance, and it covers all. It's universal dental care is what they're looking at doing. I just read that story.
Wow.
I didn't read the whole thing, but they're looking at doing universal dental care. So it would be across the board. Every dentist would have to take universal dental care. This is how much you get paid. It would.
Then the quality's going to go down.
Oh,
Yeah.
Mm-hmm.
Like,
so you
where can
see,
you cut
like I
costs?
said,
Yeah.
what are the things that we do? Why does it cost so much?
Your quality of your lab.
Mm-hmm.
You've never skimped on that.
Totally.
All the years I worked for you, you've been with them.
When I worked at as an assistant, I would see the invoices too. In the back of the other office I worked at as an assistant, and I remember when I started working for you, I was like, he's paying 3 times the price, and his crown price is actually lower than the office I just came from. And I was like, what? That doesn't make sense, because they were using maybe not that local labs aren't bad and stuff, but it's because you integrity wise loved this particular lab and stood behind it and have loved it and used it your whole career. Yeah. So it was worth you, and I valued that. And I even tell people when I interview, I always valued that you weren't in it just to save a quick buck and get the China crown or things like that, that a lot of people don't even realize what they're getting, that you would rather spend more to stand behind your product that you're producing and putting in their mouth. It's their body, and spend more and make less. So I always valued that, even coming just from that side to see the invoices. I was like, wow, people have no idea.
I don't think people do understand what it takes to run a dental practice, and our costs for what we utilize. In comparison, I didn't realize like running a general medical practice is very inexpensive in comparison to a dental practice.
Oh, really?
Well, look at
the
Mountain West.
overhead.
Look at what Mountain West is part of our office now, and to set up a room in a dental office is about $60,000 to $80,000. To set up a medical office, the room itself, just to set it up,
The chair, the bench,
I
a couple
think it's like
thousand.
maybe 5.
Yeah, with probably the monitors.
And if you got really nice cabinetry, maybe 10.
Mhm.
But it
true.
is dramatically cheaper.
It totally is. Mm-hmm.
And so it's just the cost of the overhead and what it takes. And I can't do anything without an assistant.
Mm-hmm.
I mean, and usually I have 2 that we're constantly going.
Mm-hmm.
So I do see that as a difference between
Mm-hmm.
the different industries. What would you say would be one of the reasons why you've lasted so long? I mean, there's a lot of other things you both could have gone into. There's a lot of places that would. I mean, you are high quality people. Any industry, anyone would love to have you work for them. Why?
It's gonna get us all teary-eyed.
I know. I told you.
Loyalty, and
Yeah.
you've become like family over the years.
Yeah.
You've allowed us into your home. You've included us in with your family. You and Holly, the boys.
I look to you as a father figure
Yeah.
a lot of times, like for
Don't do
guidance
that.
on stuff. I know. I'm like, for guidance on stuff, or I love you sharing your views and stuff. I don't have that in my life and haven't had that in my life for a long time, since I was 16. And I didn't know that I could have that at a workplace. I always look up to other people you work with, but I feel like, and you keep it so fun.
Mm-hmm.
Like, I just
Light.
remember externing, and then I loved the other dentists I worked for. They were super great. Nothing bad to say about them, but you just had this fun atmosphere that like draws you in, and the connections. Like you're not just all business.
We laugh a little bit.
A little bit. Yeah. I have to rein it in sometimes.
Rein it in?
Rein it in on
I
our
know,
lunch meetings.
There's Mother Deborah reining it in again. That is probably, we need that. That is true. We do have fun though.
We do. We totally do.
Okay, so what is a question of the day that you remember? Every day there usually is a question of the day. So give me one question of the day that we've asked that you actually remember. If you can't, then I'll give you you guys didn't get the question of the day yesterday?
No. Sometimes at the front desk we don't get them.
Oh yeah, you don't want to get them all, do you?
Occasionally, when you got something good, you'll bring it to us.
Okay, I'm trying to remember what the question of the day was yesterday. It was, if you could have a robot do one of your chores that you would have in your home that you would never have to do again, and you can't do it again.
I already know.
I know too.
Okay, wait. I'm gonna get. I almost guarantee what it is. Okay, and they're gonna do it perfectly.
Oh, beautiful.
Be amazing.
What is that?
Should we say it together?
I already know. Let me guess. I'm gonna guess.
Okay.
Laundry.
Totally. Yes,
100%.
the laundry.
My piles of laundry.
Yeah. So
My
I thought
couch
about
of
that.
clean laundry.
And my wife absolutely. I don't. She loves to fold. But you know what? I think she would give that up to have them do all of the laundry.
Oh,
And
yeah.
put it away.
And put it away pretty in the drawers.
Perfectly.
Like a store.
Oh, yes.
Pull it all out.
And
Okay.
see it all.
You would take that over someone like a robot that would cook perfectly all your meals,
Yeah.
or
I
do
would.
all of your dishes and you never have to touch that again.
That's okay.
See, for me, I would pick the robot that I would never have to do any more dishes. I could go in, make a huge mess and cook, and they would clean everything up. That would be amazing. So I literally listened to this podcast. It was over the weekend with Joe Rogan, and they actually were talking about robots and AI, and they were saying within as early as 10 years, but for sure 20 years, the majority of all jobs would be lost to AI.
That's just crazy and sad to me.
That's weird.
All jobs.
Do you want a hygienist robot?
No.
I don't think our industry is that potential of losing our jobs. So I don't see that happening for us, and I'm grateful for that because I don't see people potentially. There is robots that do some of the work that we do now, Like they have robots that can place implants and things like that.
Oh, I remember you wanted one of those.
I almost bought it.
I was like,
Thank God you shut that down.
Yeah. It's extremely. I'm so glad I didn't buy that.
Now we
it's
have
like
our
a transformer thing you were explaining to me.
Now we
I
have a
was like,
better way of doing it. But can you imagine going to and sitting in a spot because they would have to strap your head in,
ugh,
and then the robot would go in and do your teeth?
no,
Would you have a robot do your Botox
no,
compared to like a nurse that actually is looking at you
No.
and doing that?
no, they're gonna hit your head harder, like your bone, like it's gonna hurt.
I'm just thinking,
Yeah.
in medicine, when are we going to trust AI more than we are going to trust an actual practitioner?
I don't think I would. I don't know about the younger generations, maybe.
But see, here's where I see the difference. I think if you went to a medical provider robot
Mm-hmm.
and they were able to be your general practitioner, that you
Give you
put
what
in,
you want.
well, that is what
Yeah,
they,
a
but you
box
put
of
in
all
all
over.
of your information and they go in and they immediately take a blood sample and they analyze everything and they go, okay, this is what you need. I could see
The
that
blood
coming
sample thing, yeah, that's
very,
cool.
very quickly.
Mhm.
Yeah, it's almost like the entire entertainment industry is going to be, it will all be AI.
Oh, wow, yeah.
There will be,
That's weird.
they say
That is
within
weird.
10 to 15 years, we might not even be able, or the government will take away our ability to drive.
That's scary because, like, my husband's in cybersecurity. Like,
Oh,
the
I
potential
don't
of
want that.
hacking, that just always scares me.
Well, like Joe Rogan said, he goes, it would be 100% safer and 100% less fun.
Oh, it would be scary, though.
I don't want some robot to drive for me. I want the ability to be able to drive. Anyways,
Yeah.
I just think that that's kind of
Yeah.
interesting to think of, that as fast as the cell phone came on, AI is going to wipe that. I mean, what is going to happen with technology is going to absolutely astound us. It will both be really good and potentially really bad.
Well, we're getting more. The insurance company this year, with all of our claims that we try and help patients with, they have no idea how many hours Mindy and we struggle with for them. They have a lot more AI programs now reading it. So they're rejecting them
Denied.
every time now. And then I called the other day about something to help and was on the phone for an hour, got to a person, and they're like, oh, yeah, well, even if you're mailing them in now, like if they look at it quick, the people, they're just plugging it into the machine and the AI might just be duplicating it and rejecting it again. I'm like, but we're mailing it in for someone to look at. So it's causing a problem in like the billing world and the patient.
Deborah, I think that's a
like,
great
yeah.
topic.
Mhm.
What is the difference between dental insurance and medical insurance? A lot of people don't understand it.
Oh, it's really different, which again, I love that you push me and always growing opportunities. I learned how to do some medical billing for patients. We were trying to really help that to get patients reimbursement possibly. And it's so different because a dentist, you just do what you like diagnose and do it. You don't have to have you have to support your x-rays and prove what you did now more so, and a doctor just says, this is what I'm diagnosing, this is what you need done. So they have to have diagnosis codes and modifiers and all this stuff, but we have to like prove so much now.
Mhm.
Like before x-rays, after x-rays, intraorals, you missed a part of the root even though we only did a filling or a crown. Like they're getting so picky, like people have no idea.
So why are they?
Because they're trying to save money for them.
Yeah, so
like
the
non-profit.
Well,
like,
even health insurance, medical insurance, dental insurance, it doesn't matter. Anytime they can deny, they are actually making money by not giving out the benefits to the patient.
Oh, 100%.
That's the reality.
And most offices don't question the why. Well, why was this denied? And I'm a why thinker, and Mindy, who you'll have on later, she's totally that why thinker. Katie is. I love our group that we have. We question and push. A lot of offices just are like, oh, it didn't get covered. So because they'll actually even put, I don't know if I've ever told you this, they'll just put generic responses, and it's not even the real reason. Like, yeah. So you have to be like, okay, that's not true. And then you call and they're like, oh yeah, that was just a generic response. Well, why did you put that then if you need the crown seat date? Why did you put it wasn't covered? I don't get that. Like,
well, the crazy thing about dental insurance is that dental insurance, when it first started, like in the 1960s, late 60s,
Yeah.
70s, they would give you about $500 to $1,000
It's the
for
same
your
almost.
benefits back then.
Mhm.
A crown costs $50. Now a crown in our office, a straight regular crown, porcelain crown, is how much?
$1,414.
$1,414.
Mhm.
And so most dental insurances are $1,000 to $1,500
A year.
a
they'll
year
pay out.
max.
Mhm.
That so instead of it being $50, 2024, it is now it doesn't even cover one crown.
You're
Yeah.
cleaning your X-rays, your
And they
exam,
paid
all
out
that
at
stuff now.
percentages too. Like, so we'll cover your crown, but at 50% out of your $1,000.
So it's just the opposite
Yeah.
of medical insurance.
Nickel and
Medical
dime.
insurance, it is okay. Here's your deductible. This is what you have to pay. $3,000 is your deductible, and then your insurance kicks in for the remainder portion of that. If you have these large treatment plans and you have a $20,000 case, you might get $1,400. The problem with that, even the larger the treatment plan, sometimes the insurance companies look at it and go, "Oh, that's all cosmetic. We're not paying for any of it."
Mm.
That is, and so it's amazing to me when we talk to patients and they get upset about the front desk and the people that work, like you two, and I tell them they're your number one advocate.
Oh, 100%.
They're the
for
ones that
sure.
are going to go to bat for you when it comes to your insurance. You need to be friendly with them. Yeah, don't take that away from the opportunity to be able to work with you guys. So I appreciate all that you do. It is
Katie does a ton now too. That was probably so different for her coming from the back to the front, learning.
It was.
She helps send a ton of insurance too, and it's just
how many employees do we have at the office now?
like 18.
And like 80% of them are working up front. Is that right? That's what it seems like.
No. I know. I keep thinking, like, I used to do all of that. I used to do all of that job and that job together. No wonder I always had this huge stack on my desk. Like,
So there's
I have
5
little
of
stacks.
you, right?
In the yeah.
Total front is 5
Mhm.
that we have working.
Yeah.
And I think you guys are an amazing team. The front office.
Oh yeah.
We have an amazing team overall.
We totally do.
Mhm.
Everyone cares, and everyone always wants to help the patients or help each other. Really good
Get
team.
along.
Mm-hmm.
No drama.
And we don't need any more employees.
Not right now. An associate, but maybe.
We need another
In the
doctor.
future.
That's true.
Yeah.
Well, it's wonderful having you two on today. If you were going to have somebody that was going to take your position, you were done. What would be your words of encouragement? What would be that you would tell them on your way out? I'm not saying you should
I
be.
know. I'm like,
By all means, I'm not saying that. But if you were like, okay, you know what? To do my position, this is what it's going to take. Katie?
You're going to love it. You're going to love it. As stupid as that sounds, it's like joining a big family. I've gotten so much support from all the staff, from you, it's just, you become family.
You besties.
Mhm.
Yeah. Mhm.
Totally.
Deborah?
I feel so similar too. Like, the grass is not greener, but it's definitely greener where we're at. I don't need to look. I don't want to leave.
So you got another 10 years in you?
Don't retire.
Well,
I know.
hey,
I'm like, don't retire, McRae.
I don't plan
They're
on
older
it.
than us. Come on.
I can honestly say I love you as family.
Oh,
And thank you for all that you've done.
We love you
I
too.
love you too.
For sure.
Yeah.
Till next time.